Hi, my name is Dominic Blanco, and the topic I'm presenting is HIV/AIDS for Bio 54. Some background info on HIV. HIV stands for Human Immunodeficiency Virus. It is a virus that attacks cells that help the body fight infection. It is constantly attacking your body's immune system. CD4 cells are constantly under attack, which are also known as T cells. HIV can eventually lead to AIDS. It is a lifelong disease, and as of now, there is no cure, but we can control HIV. And on the bottom right, there's a GIF with the HIV virus in the human body. Some symptoms of HIV. Basic symptoms for many different illnesses. Can include flu-like sickness in the early stages. Symptoms include the following: fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Some of these symptoms can be seen on the bottom image. Some background info on AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. When CD4 T cell count drops below 200 cells, AIDS is formed. With 35 million people currently being affected by AIDS, it is a growing situation that needs to be controlled. 39 million people have died around the world from AIDS. So I have two images on this slide. The one on the right being the anatomy of the AIDS virus, showing all the parts that make up the AIDS virus and how it looks. And on the left, there's a GIF that shows the AIDS virus in motion in the human body. The HIV/AIDS epidemic. The first case was reported in 1981. Early cases were found in homosexual men in Los Angeles. Early concentration spread among the gay community, which led to protests, which can be shown on the bottom image, for research and for the government to get behind and look more into the situation. But stigmas prevented early action for AIDS because they thought it was just from unprotected sex, when there's many ways that one can get HIV/AIDS. HIV/AIDS in the U.S. Around 1.1 million people have HIV/AIDS in the U.S. 1 out of 7 Americans are aware that they have HIV, which is insane to think about, considering that this virus can spread even more and form like a snowball effect, in which people who don't even know they have this virus, they keep having unprotected sex or other ways that you can spread it. And it just keeps spreading, and it just will continue to grow. In the U.S., bisexual and gay men who have sex with men have the highest risk of getting HIV. Some symptoms of AIDS and resulting diseases include rapid weight loss, recurring fever or profuse night sweats, extreme and unexplained tiredness, neurological disease such as meningitis, prolonged swelling of the lymph glands in the armpits, groin, or neck, diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, lung diseases such as pneumonia and tuberculosis, memory loss, depression, and other neurological disorders, colored blotches/lesions on or under the skin or inside the mouth or nose. And on the right, there's an image with the main symptoms of AIDS, and it breaks down into more detail. Now on to the next slide, which is testing and treatment options. To test to see where the disease stands include CD4 T cell count, viral load, HIV, RNA, and drug resistance. That is to test whether or not you have HIV, and if you do, to test how far you are along the process, which stage you're in. it cannot be cured. There is treatment that focuses on living with HIV/AIDS. Those treatments that are available for HIV/AIDS include non-nucleoside reverse transcriptase inhibitors, otherwise known as NNRTIs, which turn off a protein that is needed by HIV to make copies of itself. Nucleoside or nucleotide reverse transcriptase inhibitors, NRTIs, are defective versions of building blocks that HIV needs to make copies of itself. The next being protease inhibitors, PIs. They are inactive protease, which are another protein that HIV needs to make copies of itself. Entry or fusion inhibitors are next. They have T blocks that stop HIV entry into CD4 T cells. Integrase inhibitors are the last treatment, and they disable a protein called integrase, in which HIV uses to insert its genetic material into CD4 T cells. Many side effects come with treatment. Treatment may change over time depending on the patient. Not all patients are going to have the same treatments. And on the bottom right is a illustration showing all the different types of treatments that I talked about earlier. And it shows that people living with HIV work with a healthcare provider to choose an HIV regimen that's best for them. Recent progress in medicine to help fight HIV/AIDS. Single antiretroviral pill that contains 3 medications in one pill and has no side effects. PrEP pill has increased lifespan of those who have HIV. As seen in the bottom right corner, it is prevention in a pill. Taking a once daily pill can reduce your risk of contracting HIV by more than 90%, which is a huge deal in preventing it from ever happening in the first place. And as federal funding increases, treatment and medication has improved, which can be seen in the figure 1, where the U.S.'s federal funding for HIV/AIDS is total now in the year 2019, $34.8 billion, which is huge. Prevention methods. Follow an effective HIV prevention program. Use condoms during sex. Start taking medications such as PrEP to prevent HIV. Making sure needles are clean when they get injected into your body. Medication called PEP, which also helps with HIV. STI treatment and monitoring. And then in the bottom right corner, there's another image which says effective HIV prevention programs require a combination of behavioral, biomedical, and structural interventions. All those will help. All 3 of those categories will help to prevent HIV. The current state of HIV/AIDS. The number of adults and children with HIV are falling. Absolute numbers of deaths due to HIV have been shrinking. Global spending on research appears to be growing, as seen in the last slide. As such, the number of people living with HIV is increasing. HIV infections are decreasing. Estimated diagnosis of HIV infections in the U.S. That's my presentation.